Hello, I am Bailey Hayes and I am a student nurse from the University of Wisconsin-Oshkosh. I am completing my community health clinical with the Pepin County Health Department over the course of about 6 weeks. During my time here, I decided to work on the Community Health Improvement Plan for Pepin County from 2016 to 2020. This is also known as CHIP. This was addressed in 2013 where they first assessed the community needs in Pepin County. Then the first stakeholder meeting was held in 2014. The three main goals of this plan include by 2020, reducing abuse of alcohol and other illegal drugs, reducing the relevance of obesity and chronic disease, and lastly, improving mental illness through prevention and by ensuring access to appropriate care. I decided to work on the second goal of by 2020, reducing the relevance of obesity and chronic disease, being there has not been a lot of interventions documented on this goal thus far. I completed a survey that was sent to 75 different key stakeholders in Pepin County to monitor the halfway progress of this plan about what interventions are already in place as well as where there is room for improvement. These included businesses, schools, government organizations, healthcare organizations, and nonprofits. The process that I went through with CHIP was assessment, diagnosis, planning, implementation, and evaluation. Looking a little at the data in Pepin County, the total population is 7,254, with 98.1% being white and 49.2% being female. So there's a pretty even split between male and female. Looking a little at education, 90.9% of people have a high school diploma or higher, and 18.3% have a bachelor's degree or higher. This looked at adults ages 25 and older. The median household income is $51,346. The reason I decided to look at this objective was because in 2014, which is the latest data available, 34% of residents in Pepin County were considered obese. In this study, those 20 and older with a BMI greater than 30 were considered obese. As you can see from the graph, adult obesity in Pepin County has been slowly increasing and rates are higher than both in Wisconsin and the United States. Here's a map of the percentage of population with obesity by state in 2014. As you can see, Wisconsin is in the 30 to 35% range. Here's a graph showing Pepin County's physical activity, or lack thereof, rates. As you can see, it is remaining relatively consistent. In 2014, it was at 26%, despite the fact that 66% of the population had access to exercise opportunities. This includes parks, gyms, pools, trails, etc. In this study, those 20 and older who reported having no leisure time at physical activity were considered physically inactive. Chronic conditions have also seen an increase. Diabetes prevalence is at 11% in Pepin County and 9% in the state of Wisconsin. Patients were recorded to have diabetes if they said yes to the question, "Has your doctor ever told you you have diabetes?" Diabetes monitoring is also at 84% in Pepin County, where it is at 90% in the state of Wisconsin. Diabetes monitoring is the percentage of diabetic Medicare patients ages 65 to 75 whose blood sugar control was monitored in the past year using A1C levels. Some of the benefits of physical activity include controlling your weight, reducing the risk of heart disease, type 2 diabetes, colon and breast cancer, and arthritis. Physical activity can also help strengthen your bones and muscles, improve mental health and mood, improve ability to do daily activities, and prevent falls. It is recommended to perform at least 150 minutes of moderate intensity activity a week to help maintain your weight. Physical activity can also increase your chances of living longer. Being physically active 7 hours a week can have a 40% lower risk of dying early than those active for less than 30 minutes a week. Benefits of healthy eating include a balance between calories burned through activity and intake of calories through beverage and food. Healthy eating is important to maintain healthy weight, promote health, and prevent chronic disease. The diagnosis that I came up with includes increased risk of obesity and chronic conditions among residents of Pepin County related to increased obesity and inadequate physical activity, as evidenced by Pepin County currently has an obesity rate of 34% as compared to 31% in the state of Wisconsin, and physical inactivity rates in Pepin County are at 26% as compared to 21% in the state of Wisconsin. The overall goal was to reduce the relevance of obesity and chronic disease in Pepin County by 2020. There are two objectives. The first one was to reduce the percentage of Putnam County residents who report being overweight from 36% to 30% by 2020 using countywide survey responses collected. The second objective was to increase the percentage of Putnam County residents who engage in 30 minutes of physical activity at least 5 days per week from 42% to 47% by 2020 using countywide survey responses collected. The results of my survey include focusing on the objective of reducing obesity and chronic conditions. I surveyed a total of 75 key stakeholders on community health needs and implementations. Like I stated earlier, this includes schools, healthcare organizations, businesses, nonprofits, and government organizations. Out of 75, I had 15 respondents, which put me at a 20% response rate. Healthiest Wisconsin 2020 focuses on 23 focus areas to be addressed by public health system partners in Wisconsin communities from 2010 to 2020. The survey assessed the following focus areas from Healthiest Wisconsin 2020: adequate, appropriate, and safe food and nutrition, chronic disease prevention and management, physical activity, and obesity. Some of the implementations that have been made through the survey results are that 100% of respondents had water readily available either through bottled water or by water fountain, 55% provided healthy vending options, and 50% provide bicycle storage, which helps promote active commuting to either work or school. Some comments about implementations made were: we promote parents to supply healthy snacks for their child's snack breaks. We have fruits and vegetables available at lunch each day. We do not have vending machines. Students are encouraged to have water bottles on their desks, and water breaks are given throughout the day. Meals provided by parents for staff include bottled water, no soda. We promote and provide classes for those with chronic conditions. 4 other respondents also commented that they encourage employees to walk during their breaks. Some areas for improvement that were found throughout the survey results were that 75% listed limited access to facilities as a major barrier. 100% stated that they do not currently provide discounts on healthier foods, with 67% stating cost as a major barrier, and 60% stated that they currently do not have an employee wellness program. One comment about an area for improvement was that there is a lack of knowledge of opportunities, which is a major barrier. One recommendation based on areas for improvement include that it was found in a research study that pairing financial incentives and restrictions on foods and beverages purchased may support healthier food purchases as compared to those with no incentives or restrictions. Affordability, convenience, and availability of healthy food needs to be improved. Some ways to accomplish the incentive portion would be through offering price discounts on healthier foods, increasing healthy vending machine options, and offering financial incentives for healthy food purchases. It is shown that these, in combination with restrictions on unhealthy foods by increasing prices of sugary drinks and unhealthy snack taxes, have been effective when making healthy food choices. It is important to note that it is the combination of both incentives and restrictions that has been shown effective versus one or the other. Worksite wellness programs have also been shown effective to help employees reach their short-term health goals, resulting in weight loss. If financial rewards are offered, it can increase participation among employees. It is important to raise awareness, and some examples would include biking to work and walking during your lunch break. Businesses may also receive tax credits for workplace wellness. Workplace wellness initiatives that include financial rewards for healthy behavior can generate cost savings for the employers. These savings result from reduced absenteeism, lower use of healthcare services, and/or reduced workers' compensation and disability claims. It is important to note that it can generally take 2 or more years for our savings to be shown after implementation. One example of a wellness program was employers may reimburse employees up to 30% of the cost of their coverage if they reach defined health targets. It is also important to note that HIPAA requires that employers offer reasonable alternatives for employees who are medically unable to reach those targets. It was also shown in the survey that there needs to be an increase in awareness of community fitness programs. These programs can help increase physical activity and have been shown to increase with social support. Organized fitness programs appear to be more attractive to women and elderly adults than to men and younger adults, while organized sport activities appear to appeal more to males. Physical activity regimens that include regular feedback, self-monitoring tools, some form of social support, variety in the activities, and friendly competition appear to encourage adult male participation. Endless Summer Fitness in Durand, Wisconsin offers a variety of fitness classes and 24/7 access. Fit for You in Pepin has a full weight room, a cardio area, and a space designated for fitness classes. The Durand, Arkansas School District also provides a fitness center for the community. It is available for non-student adults only. The fitness center is open from 6:30 to 8 p.m. Monday through Friday. Here is a list of my references. Thank you for taking the time to listen to my presentation. Great job on working on improving the health of Pepin County. We are making great progress towards reaching our goals in 2020.